All right, let's go into the Zoom room where we have Peter Santos. He is over at Ukadu High School, where public health is holding another vaccination clinic. Initially, it was supposed to end, I thought, on Wednesday, but here we are, another clinic on Thursday. So, good morning, Peter.
Hi, good morning. Hey, Bree. Hey, everybody down there. It's actually the fourth day of vaccinations from Manumku here. So, yeah, I'm here with Janella, and we're going to just get some details about today and how everything's going to go after that. So, I'll go ahead and switch it over to Janella for you.
Okay.
Okie dokes. Okay, so like what prompted a fourth day of testing?
Sure. So, we had a really great turnout Monday, Tuesday, and Wednesday. And actually, it was Tuesday night when we decided to add the fourth day. When we saw that large, massive turnout on Tuesday, we realized that, our Manumku really want to get the vaccine. And so we decided, you know what, we've got this great momentum going. We know that our Manumku really want to get vaccinated. And we don't want to be turning them away. 75-year-old and older category is a really vulnerable population. The CDC recognized that. We recognize that. They have been really the hardest hit by this virus, this pandemic. And we want to give them really this great hope to look forward to, especially with the new year coming. So we added a fourth day, an extra day, just for them to really come out. And with the massive turnout, we didn't want them to feel like, there was just a small window of opportunity for them to get the vaccine. So we have now a fourth day. The line is, it's a little slower. It's not as long today. Right now, actually, would be a great time if our Manumku are listening right now, or their caregivers, or their family members are listening or watching. To the link. Right now is a really great time actually to come out. We're here opening our doors till 3 or whatever time we reach that 600 limit. Now is a great time to come out. In addition to that, actually, our healthcare personnel, those who fall under the phase 1A category, I know that we initially said that we're opening up a window of 2:30 to 3 o'clock at the end of the day to come and get your vaccine if you missed your opportunity during the first 3 days to get it. You can actually come at any time as well, because our lines are really slow right now. So you can also come at any time throughout the day today, and we'll go ahead and take you as well.
So how many Manumku were vaccinated to date? Do you have a number on that?
So I know our first day we had 382. Our second day was 643. Yesterday was 715. Now that's a mixture of those who are in the 75 and older category and our healthcare professionals. I don't have the complete breakdown of how many are in the phase 1A and in the phase 1B category. But for our clinic, our total numbers, that's 300, I'm trying to remember, 382 the first day, which was Monday. Tuesday was 643, and then Wednesday was 715. So, I mean, you can see the numbers continue to increase. Today may not be as many because, as you see, our line wasn't as long when we opened our doors. So it may not be as many, but ultimately we're glad to be able to, get our Manumku and our healthcare professionals vaccinated.
Are you expecting anything different for the second dose of the vaccine, being that it's going to have to be administered, a certain amount of days after the first one? So, that day 2, I believe there's about 900 Manumku. So do you have any plans to mitigate, traffic and whatnot in the future?
Right. So that's another thing too that we are looking forward to. January 7th is the first day for the healthcare professionals. We have to start planning for that. We realize that we may not have Ukadu High School as a venue. So we are looking at the possibility of the UOG Calhoun Fieldhouse as a venue. And so we have to, of course, start planning on logistically how the operations will flow, and also for our Manumku as well. So, and it may not be UOG Calhoun Fieldhouse for all the days that we hold a vaccination clinic. For the phase 1A and phase 1B, we're looking at the possibility of other venues as well. So we are going to, of course, start planning for the vaccination clinic for phase 1A and phase 1B.
Have you received any communications from anybody perhaps from the feds that kind of brought you up to speed on the new COVID strain that's emerged in the UK?
We do have a Bureau of Emerging and Infectious Diseases that is, of course, keeping an eye and closely monitoring the situation. So definitely, it's something that we are, looking into. The one thing that we do know is that this new strain is the one thing that the CDC is saying is that studies are showing that although it may be more infectious, it appears as though perhaps the vaccine that we are using right now to protect us against COVID-19 may possibly be effective against it as well. But I know our government, the administration of public health is doing all it can to ensure that we keep ourselves protected against the COVID-19 vaccine and any possibility of new strains that may reach Guam, and hopefully it doesn't. So we are closely monitoring that situation as well.
So since we're heading into the new year, it looks like you guys pretty much got a feel of what the vaccination process is like. So when can we expect the next mass community testing?
We initially, as I mentioned, we initially had planned the mass community testing actually for today. It was supposed to be today, but because of the large turnout for our Manampu, we decided to turn today, Thursday, December 31st, into another vaccination clinic. We're actually going to have one next week, Monday and Tuesday at GCC. It's going to be from 10 to 12 noon. So from 9 to 10 will actually be for GCC, but from 10 to 12 it'll be open to the public and it'll be at GCC. We do plan to officially announce it, but we did arrange it with the GCC administration. So from 10 to 12 noon it'll be open to the public, and that'll be located at GCC. But we will make the announcement, the official announcement, so that we can inform the public exactly where at GCC and how many tests we'll allocate for those 2 days, and exactly where, what areas to pull up to, where to drive in, and the exit locations. We'll make those official announcements.
So keeping in the line of testing, do you have anything about the airport's implementation of rapid testing for arrivals?
I know that is something that's being discussed and planned out. The Physicians Advisory Group is also working with Dr. Lin, and so at GDB as well. So I know it's still very much in the infancy stages, but definitely it's something that it's a tool that's going to be used in terms of quarantine management. It's still a little too early to tell at this point how it's going to effectively manage, in terms of tourism and testing for incoming travelers. But, I think it's something that we can definitely use going forward in terms of reopening our economy. But I know that they are in the discussion phase right now.
Awesome. And so being that this is the last link of the year, do you have any message you'd like to say to the people of Guam?
Definitely. It's been such a crazy ride for 2020. But I just want to wish everybody a very, very, very happy new year. 2021 hopefully brings us, something better to look forward to. That's my wish for everybody in the new year. And I just want to thank the entire community for, coming together. I know it's been a very challenging, difficult 2020, but I think once toward the end of the year, I think we all kind of came together. I want to thank the media. I want to thank KUAM for being there, very supportive and bringing our message across to the community. And of course, everybody else, the people of Guam for being very supportive. And just looking forward to 2021 to bring us, new hope, and hopefully putting 2020 behind us, learning from it, and hopefully COVID-19 goes away in 2021. That's my hope for the new year.
Awesome. Thank you so much, Jenna. I appreciate your time.
Sure, no problem.
Thank you.
Thank you.
So yeah, Bree, everything is looking a lot different than day 2.
Right.
So a lot slower, a lot smoother. Actually, the Manamka that I've seen being dropped off actually don't even spend a minute outside. Everybody kind of just gets escorted into the building. They got snacks and drinks outside. Everybody seems to be in pretty good spirits. So
All right.
it looks like our Manamku either all got vaccinated or they're waiting for the next round.
All right. Thanks a lot, Peter.
Thank you so much. See you guys soon.
All right. See you guys. See you soon. Again, as Peter Janello were mentioning.